Signed up for the webinar, the Zoom called Motivational Interviewing for Loved Ones, Enhancing Family Communication. And we're lucky to have Dr. Emily Kline join us tonight. I'm just going to give you the briefest introduction here, and then Dr. Kline will take it away, and we will take your questions after her talk. If you have additional questions, please put them in the chat. Try to keep your picture off the screen because we are recording it. So if we see you on the screen later, we have to edit you out. Question. How can we help the people in our lives who are obviously struggling but push us away? How can we talk to loved ones about unhealthy behaviors without making them angry and defensive? A communication strategy called motivational interviewing is widely used by health professionals to enhance people's motivation to make positive changes. Dr. Emily Kline, our guest tonight, will share how to have better, more productive conversations about everything from hygiene to medication. Dr. Kline is a clinical psychologist with 20 years of experience working with individuals and families in community mental health settings. She has held faculty positions at BU and Harvard Medical School. Dr. Kline is the author of The School of Hard Talks: How to Have Real Conversations with Your Almost Grown Kids, and the creator of The School of Hard Talks Online. Her writing has been featured in The Globe, Parents, Psychology Today, and peer-reviewed scholarly journals. She has spoken with audiences all over the world about mental health and communication. Dr. Kline completed her bachelor's degree at Haverford College, her master's and doctoral degrees at the University of Maryland, Baltimore, and her clinical and postdoctoral training at Harvard Medical School. She lives in Boston with her family. Dr. Kline, thank you so much for joining us, and I will turn it over to you.
All right. Thanks, Rich. Good to see some familiar names and faces tonight. Thanks for coming out, and hopefully this will be a useful hour and a half, that'll give you some ideas that you might want to try out with your loved ones. Let me just tell you a little bit more about myself. You got my bio spiel from Rich. Um, I am a patient-facing psychologist. I see um, kids, families, adults 5 days a week. I see a lot of patients at Roslindale Pediatrics these days. That's kind of my primary clinic home, um, which is like a primary care office in West Roxbury. But I also stay busy with like a small private practice that I do. I see parents like yourselves who are struggling with communication or adjusting to kids' diagnosis. And I also do a lot of teaching and consulting because there's a lot of people out there who want to learn motivational interviewing, and I love teaching them. So, um, if you know anyone who wants to learn motivational interviewing, definitely throw my name out there. It's fascinating, all the different groups and companies and nonprofits that I've worked with. So I didn't invent any of these tools. I just find them incredibly useful in my own clinical toolkit. And what I did do was I had this idea that, hey, we learn this as therapists, doctors are supposed to learn it. But a lot of the parents I work with would really benefit from learning some of these tools as well. So what I did was using grants from Massachusetts Department of Mental Health, the National Institute of Mental Health, and working with a Penguin Random House imprint called Sasquatch. I created all these different curriculums for parents to learn motivational interviewing. And I'll tell you about some of those resources at the end and as we go through. I don't have any particular commercial interest in developing this. All right. So for those who kind of signed up for this because they liked my description of motivational interviewing, but maybe you never heard the term itself, I want to just tell you what it is. So it's a communication style that was developed in the 1980s in the context of alcohol use disorder treatment, alcoholism treatment. And it was developed by two psychologists who really found that this style of a more collaborative kind of conversation um, helped patients who really had their backup about their alcohol use relax and think through their own ambivalence about, there's part of me that wants to quit and part of me that doesn't want to quit, and talk that through. And they found that um, those people seem to do much better over the long term than the ones who, were approached with in a more confrontational, like shame, 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 you're a terrible person, I can't believe you're still drinking kind of way. So they articulated the both the philosophy and a set of sort of strategic conversational moves into this thing that we call motivational interviewing now. And it's been tested in lots and lots of studies, both for addiction treatment, where that's where it's primarily used and what it's known for is sort of a tool for addiction treatment, but also in lots of other realms, looking at lifestyle interventions, medication adherence. Um, it's really just a way to talk about changing difficult behaviors, where people might be defensive, and we're all defensive when we are confronted with behaviors we need to change. The basic premise is that we don't control anybody. We just don't. Our power over other people is so limited that usually our best tool for influence is the relationship and just helping them figure out whether they want to change, because we can't make them change. Our leverage is so limited. So parents might want to try using MI or other loved ones. It doesn't have to be parents, could be siblings, spouse, friend. Um, but loved ones might try and use MI because they're just not sure how to start a conversation about a difficult topic that maybe they've been avoiding. You all wrote in with such incredibly awkward conversations that you need to have about money and showering and dentist appointments and all these things, really difficult stuff. Um, or maybe you have been having the conversation, you've been quite assertive in the conversation, you've really put your foot down, and you still didn't get the result you want. So you're interested in trying something new or a different tactic. Um, or maybe you're just feeling desperate and you just want to improve your relationship with this other person, even if it doesn't lead to exactly the change you're hoping for right away. So I'm going to teach you as much as I can in the next hour, and then we can, and in doing that, the way that I learned psychology, was really to talk through incredibly specific case examples. So I always get right into the weeds. But first, I do want to give you a little bit more of the kind of flavor and philosophy, um, of MI. So one of the most important things to know as you're venturing into this is that when you see someone you love struggling and you want to help them, there's that urge to help is not always exactly super productive. So I'm going to show you a short video that, apologies to those who've seen me or seen this before. I always share it, but it's because it's so rich and I think it really drives the point home. So let me just pull that up and get the right video going for you.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
No, see, I don't think that is what you need. I think what you need is to get the nail
You're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just
Don't.
try to see things my way. Well,
All right. So, as always, I just want to shout out this amazing writer, Jason Headley, who knows that therapists love this video, and gives us permission to use it. So that's just one example of sort of that impulse to try and help someone by pointing out, this isn't going so well for you. Let me tell you how to handle it, and being met with a lot of resistance, fairly irrational resistance, right? So that might feel familiar to some families in the audience. And then I have one other video that, might be relatable to you all that I'm gonna also show, um, just about another way of trying to help someone who needs some advice, but it's not going so well.
episode 74, episode 3.
Whoa. Oh, you guys made me eat. Dad. I know what that is. Sandy Plankin saw one. He said it was called a butt. It's a pretty big butt. Oh, look at me. I'm gonna go touch the butt. Yeah, let's see you get closer. Okay. Beat that. Come on, Nemo. How far can you go? My dad says it's not safe. Oh. Dad? You're about to swim in open water. No, I wasn't gonna go. I haven't shown up. I don't know. He wasn't gonna go. Yeah, he was too afraid. No, I wasn't.
This does not concern you, kids. And you're lucky I don't tell your parents you were out there. You know you can't swim well.
I can swim fine, Dad, okay?
No, it's not okay. You shouldn't be anywhere near here. Okay, I was right. You know what? We'll start school in a year or two.
No, Dad. Just because you're scared of the ocean.
Clearly you're not ready and you're not coming back until you are. You think you can do these things, but you just can't, Nemo.
I hate you.
Nothing to see. Gather, over there. Excuse me, is there anything I can do? I am a scientist, sir. Is there any problem?
You know, I'm sorry, I didn't mean to interrupt things. He isn't a good swimmer, and I just think it's a little too soon for him to be out here unsupervised.
Well, I can assure you he's quite safe with me.
Look, I'm sure he is. But you have a large class, and he can get lost, from sight if you're not looking. I'm not saying you're not looking.
Oh my God! Nemo's swimming out the
Nemo! What do you think you're doing? You're gonna get stuck out there, and I'm gonna have to get you before another fish does. Get back here! I said, get back here!
Okay, I'll stop it there. But maybe one or both of these scenarios feels familiar for people, in terms of trying to intervene with a loved one and being ignored, argued with, not taken seriously, and even though you know that you're offering very good advice. All right, so I have to find my slides again. Here they are. Okay. Awesome. So this is an important concept in motivational interviewing, and we call it the writing reflex. And it's that impulse to help someone you care about by either fixing their problem, like, the dad in that clip was like, no, we're just going home. That's it. I'm fixing this problem. I don't want to deal with it. Or giving them advice, like we saw in the other clip where he's like, if we got that nail out of your head, I think these problems would go away for you. It can also show up when we try and offer reassurance, weirdly, and tell somebody, oh, you're too worried about this. It's going to be fine. Those are all ways of trying to help somebody, but it's often not well received. And it's helpful to name that reflex, the writing reflex, because once you name it, you can recognize it popping up in yourself. And it's once you can do that, you can tell yourself to slow down. So I'm going to kind of tell you about the skills, but I also want to give you lots of examples, like I said, because I find examples and specifics so helpful. One thing I'm going to play for you as we go through is some clips from some research studies that I conducted a few years ago. So I was looking at whether parents would want to learn these skills um, and would benefit from learning these skills. And these parents, I had 131 people who volunteered for this study, which was awesome. They all had teenagers or young adults at home with mental health struggles, and they let me record them. Now, I didn't want to mess with their kids because their kids didn't volunteer for the study. It was really the parents volunteering for the study. So what we did was I had them talk to my staff, who were in many cases about the same age as their kids, like college students and young adults, about problems that my staff were having. And then we recorded the conversations, and we just gave them no particular instructions other than, I'm going to tell you about an issue that I'm having, and I want your help resolving it. Just try and talk me through it. And so you can see how different people approach this task very differently. And we also wanted to see, before versus after they did the training, were they more likely to try and use some of those motivational interviewing skills? So this is a conversation from before a training that this lady, who was so great to let me use this for teaching purposes, um, she had with my research assistant at the time, whose name is Simone. And Simone is going to tell her about a problem she's having, and then they're going to talk it through. And I want you to listen for that writing reflex, and whether it's trying to give advice or minimize the issue or solve the problem. Try and hear it, and then see how Simone kind of reacts. And her reaction here is genuine. None of this is really scripted.
So, my situation is that I am hoping to get back into dancing. I want to audition for a local dance company next month, but I have some reservations about it. I've danced my entire life, and that itself has been really positive for me, but the social atmosphere that kind of comes along with jumping into unfamiliar dance environments has been both positive and negative for me in the past. And these experiences have made me distance myself from dance, even though I love it and do miss it. Um, so I'd say like I do really like going with friends, which that has been positive in the past, finding someone to go with me. But I would like to not have to necessarily rely on another person to go. But it seems like that is kind of something that's gonna ultimately make me end up going. But that's where I'm at.
All right. All right. Well, I think it's great that you're gonna start doing dance again. That's really wonderful because you're so good at it. And I would just recommend, you're always gonna come upon people that are different. Sometimes if you just burst on through, the first day, and even if you're scared, just keep going. Think of the way it makes you feel when you're dancing. And that would be, and hopefully as you're plowing through, it will take away any insecurities, by facing it straight on.
Yeah, I think that I think it's just a matter of I don't know. I just don't have the motivation. Like I'm motivated to go, but one, there's a pandemic, so I can't do anything right now. It seems like, but two, I feel so strongly about all of the stuff that I've encountered before that I just don't even know how I could even get to the point where I can go.
Mm. All right. So what I hear when I listen to that clip is like a very well-intentioned but very strong writing reflex, right? She gives her advice and she also minimizes the issue. She's like, you're going to be great. Don't worry about it. This always happens. You'll be fine. And then I hear Simone, she doesn't seem to move any closer to the goal. She seems actually to kind of get discouraged and move further away. So that's all kind of what not to do, right? Or what we have already tried that isn't working. Even though there's nothing wrong with trying those things. But you're here to learn something new, so I'm going to give you some other strategies here. So one more bit of sort of philosophy before we go into the strategies is that, I like to put it simply, change is hard, right? Change is hard. If it were easy, we would have done it already. There's a reason that I haven't quit smoking or taken up running or put a whole bunch of money in my retirement or any of these other things that I feel like, oh, I really got to get on that, right? Reduce screen time, eat organic, like all these things, right? The reason I haven't done those things is not because I don't know that those are good things to do. It's because those things are hard to do. And I might need some support with actually getting them done. And I might benefit from advice of those who have successfully tackled these things before me. But I'm also likely to get defensive if I'm confronted about these things and made to feel embarrassed or ashamed. But I'm likely to do my very best thinking about, this is actually a change that's important to me. How should I go about making that change if I'm feeling these three things? First is feeling understood. If the person who I'm talking to gets me, likes me, understands my goal, understands my value, understands where I'm coming from, then I am much more likely to tolerate their advice and their efforts to brainstorm with me. Another thing I need to feel is confident. So if you tell me, okay, you want to take up running? Great. I will come by tomorrow morning at 5 and we'll do like a quick 5 miles before you go to work. Well, I'm sorry, but I don't feel very confident in my ability to run, 2 miles, much less 5 miles. So I'm probably going to pass on that, right? The goal has to feel within reach. And I need to feel confident that this is something I can do. The third thing I need to feel is some degree of autonomy, because if people are walking all over me, telling me what to do, telling me how to live my life, even if I kind of agree with the substance of what they're saying, I might push back just because I don't like being pushed around, right? So we need to help people feel understood, confident, and in control in order to have that productive conversation about change or get them to listen to our very good advice. So how do we do that? Well, the first tool I'm going to teach you is something very simple, but somewhat unintuitive. So it is hard to do, even though it's very simple. And it's reflecting. Essentially what that means is repeating back what somebody just said to show that you're listening to them and that you're not in a rush to steer them toward a solution. So to do a good reflection, it has to be a statement, like your voice is kind of relaxed and goes down. You repeat back what you heard them say, or you kind of try and paraphrase or guess at what they might have meant. And the goal is to help the person you're talking with feel understood, accepted. And it's also a great tool to use when somebody says something that you really don't agree with. Instead of arguing and saying, I don't think that's true, you just hold up that mirror, you repeat it back, and they get to hear their own words back, and they think, oh, did I really mean that? So let me give you a couple more tips on how to do it, and then we'll go into some examples. So you can do a simple reflection where you just repeat back exactly what you heard. You can do a complex reflection where you try and repeat back the gist or the overall meaning. Or you can just try and reflect back the feeling, the emotion that is being conveyed. But the most important thing to do is to not agree or disagree, right? We're not judging, we're not evaluating, we're not saying you're right, you're wrong, I agree, I don't agree. We are putting our own opinions on the shelf for just a few minutes in order to do a reflection and get that person feeling understood. Again, it's not that you don't have opinions. It's not that you don't have good advice to give. It's that you want to get this person ready to hear it. So in order to do that, we need to help them feel understood, confident, and in control. So here's some examples. Say the person I'm talking with says, well, marijuana is legal, so it's not a big deal. I could say, you feel like it's not a big deal. Or smoking seems normal to you. Or my concern is annoying you. Here's another set of reflections. If they say therapy is dumb, I could say therapy is dumb. Truly. Or I could do a more complex reflection, like you don't feel like you're getting anything out of these sessions. Or a feelings reflection, like you're feeling frustrated. Another really important part of doing a reflection is that once you've done the reflection, you stop talking. Even if it's somewhat awkward, you let it breathe. Especially when people are struggling with depression or psychosis, sometimes their processing speed is a little slower than yours. So you want to, in general, just kind of slow the conversation down and give them a minute to think about what you've said and what they've said and what they might want to say next. So just do the reflection and then tolerate a couple seconds of silence. You could also try what's called a two-sided reflection. And this is, more varsity level stuff. But if you're hearing some ambivalence, you could point out that ambivalence, and people love this. They feel so understood. So for instance, if somebody said, well, drinking is normal, it's my brother who goes overboard, not me. I am hearing just the slightest seed of ambivalence in that statement. So I could say something like, so on the one hand, alcohol seems harmless, but on the other hand, some people who do go overboard. Okay, so that's reflections. Another tool is asking good questions. And again, this is not like rocket science, right? You've all asked questions before, you know how to ask a question. But the part that's hard is to really ask from a place of curiosity and to ask questions that you don't know the answer to. And then put it out there, tolerate the anxiety of not knowing the answer. So, for instance, you might, if somebody said to you, well, I'm not going to see that doctor again. And your impulse might be that writing reflex, right? Like, well, I'll go with you. It'll be fine next time. Or to argue and say, oh, no, 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 no. I called every doctor in town. This is the only one that takes our insurance. You are absolutely not firing that doctor, right? And those might both be really valid perspectives, but if you want to try this motivational interviewing thing, you might instead ask a curious question, an open-ended question, hopefully to get them talking. So you might say something like, okay, well, what happened when you met with her? Or what are some of the really good doctors that you've seen? Like, tell me about them. Or what don't you like about her? Or just help me understand more. Tell me more. Say more. There's a real art to trying to ask more open-ended questions instead of close-ended questions. So I have some more examples here just to kind of illustrate it. So this is a close-ended question. Do you know how hard it is to find a doctor who takes our insurance? Um, an open-ended question, again, is like, well, okay, what are the pros and cons of trying one more appointment? Let's think it through. A closed-ended question is like, well, are you just going to give up every time someone seems a little rude? Um, and a more open-ended question might be like, how have you handled rude people in the past? I know this isn't your first rodeo with rude doctors, right? How has it gone in the past? Oh, I thought I had one more. Maybe not. Okay. But in general, again, this is somewhat aspirational. You're not going to hit it every time. But thinking about like asking more curiosity-driven questions. And the cool thing about questions is that when you're preparing for a conversation about a delicate or difficult topic, you can think of questions in advance, right? Unlike reflections that you have to come up with right in the moment, questions you can plan. So that's why I like to just put in some question slides, like feel free to use these if they're useful. So a lot of families that I work with are dealing with drug and alcohol problems. So here's some open-ended questions. Try and get people talking about drugs and alcohol. Some of these are more oriented toward younger people, but you could tweak them if you're talking to someone who's an adult as well. So you could say like, what do your friends think about drugs and alcohol? Why do you think people your age are using drugs and alcohol? How are people even getting a hold of this stuff? How would where do you think the line is? Like, how do you know when somebody's having a problem with drugs or alcohol? Um, and what are your personal experiences with this particular substance? Here's some questions about hygiene. Again, I just want to throw these out there in case they're useful to anyone. This is a silly one I just thought of. Try to get a conversation started on a different note, which is like, if we had infinite money, how could we remodel our bathroom to make it like amazing, right? What changes would you want to see in your bathroom? Or what has been getting in the way of brushing your teeth or taking a shower or going to the dentist? What's the worst part of it? Is it helpful or not helpful when I remind you? Like, what do you think? Or just what can I do to support you with this? Here's another page of questions. Take what you like, leave the rest. What do you like or dislike about your treatment? What do you think about your medication? What's been getting in the way of taking medicine every day? What have you learned about mental health treatment that you wish you knew before? And again, what can I do to support you? Okay. So in a good conversation about change, you might start with a question or start with an observation like, hey, so I noticed that you didn't make it to that dentist appointment the other day. What got in the way? And then whatever they say, you try and do some good reflecting, you ask some more open-ended questions, you do some more reflecting, and you kind of try and explore the issue and really help them feel very well understood and really in control. Because also when we don't steer toward a solution right away, we are conveying subtly, but I think very effectively, I know I'm not in control. I can't just tell you what to do, right? Like whatever you come up with is going to have to work for you and you're going to have to decide to do it. But we don't want to just get stuck in kind of analyzing the problem, analysis paralysis. Eventually, the goal is to move towards some problem solving or finding solutions. So here's how I like to do that. So I like to recognize past efforts. Sometimes these problems that people are dealing with are very well established problems. Maybe this has been a problem for 5, 10, 20 years. And to pretend like, oh, I know, I have the correct answer. There's a certain arrogance there, right? So one way to kind of respect the gravity of the problem is to ask like, okay, well, what have you already tried? And how did that go? right? And review and recognize all those past efforts to solve this problem. We could also demonstrate our faith that they might have a good solution. So to ask, well, what do you think you want to do next? What did you do? And then finally, if this is going well and the person is feeling understood, confident, in control, we might be ready to offer advice. And I like to offer advice by labeling it as advice and offering it as like a gift that they can accept or decline. So I say something like, can I offer some advice? Or I have some ideas that have worked for other people. Do you want to hear about them? And usually, if we've done a good job exploring the issue, being non-judgmental, doing good reflections, they'll be eager to hear advice. And if they don't want to hear advice, I'm not going to waste my very good advice on a person who doesn't want to hear it. And I'll say, okay, cool. We'll check back in about it, in a couple weeks. Because truly, there is no point in offering your excellent advice to someone who doesn't want it. Save it. So, going back to this scenario of somebody who doesn't want to go back to a certain doctor that they don't like, I might say, well, can I share my perspective here? And if they say sure, I might say, well, I think that canceling or being late to these appointments is making her think you don't care. They don't like that. I would prefer you see her again for now, but it doesn't hurt to make some phone calls and see if there's others who might be a better fit. Or I might say, I think the medicine that she prescribes has been helpful, even if like she's unpleasant, right? That's my perspective. And then I have to remind them who's really in charge here, because it's not me, right? My perspective is only my perspective. If it's not my problem, my perspective only matters to the extent that they agree with me. So I might say, what do you think? And just kind of reminding them, like, that's my perspective, but I know that this is your problem. You're kind of in control here. So I want to give an example of what this sounds like when it's going well. And I'm going to give you, play another brief recording from that research study I told you about. So this is another parent talking with Simone about dancing. And this person has done the motivational interviewing curriculum. And I thought she did a really great job here. And so I'm not going to, Simone kind of explains the dilemma in the same way. So I'm not going to make you listen to that again. But instead of saying, oh, don't worry, just do it, you'll be awesome, it'll be great. This parent, she kind of like, she's not sure what to say at first. It takes her a minute to find her footing. But she says, like, well, just tell me more, and that never hurts. So that's always a good way to go. So we're gonna pick up the conversation there after the mom has said, well, tell me more about why you quit dancing.
It was like, I'm growing up. I don't like my body as much as I used to. It doesn't do what it used to do. And then, like, I don't get to dance anymore anyway because of all the issues. So I'm quitting that entire part of my life unwillingly, but for myself and for my own mental health. But then, I couldn't find a way back in.
Yeah, no, this sounds really, really important to you, to both, your physicality, your body, and also, just the emotional experience of being close to people and close to people who are as serious as you are. Mm-hmm. That is what I'm hearing. And structure as well.
Yeah, I'd say you hit all of them. Perfect, spot on.
Yeah. So what do you think that you could do?
I honestly don't know. I've had this conversation before, And I think I really was like very passionate about that dance piece. But now I'm wondering if I can kind of thinking about those fundamental things that I care about, like structure, seriousness, kindness. I'm wondering if I can find an active group based thing that allows me to get all of that, all of those things met, but maybe it doesn't have to be dance. And I mean, I do love dancing, but I also, I don't know, maybe that chapter kind of is closed for me. And maybe that's why I'm having such an issue getting kind of started back up with it, just because maybe I should just move to kickboxing. It's like a structured thing with the teacher that's going to be kind of encouraging us, and I'm sure that the people around me will be doing the same. So, and I'll be able to form relationships and meet people. Maybe I should look into that. I'm actually looking that up right now.
That's so great. Oh, that's exciting to hear.
Yeah,
really
thank you. That was really helpful.
Okay. I love that conversation. God, that makes me smile every single time I hear it. So I think this parent did a great job of just kind of getting Simone talking, and then offering some good reflections. Well, here's what you like about it. Here's what it sounds like you're missing. And then asking one really simple open-ended question, which is, what could you do? Right? The parent did not try and solve this problem for her. She just said, well, sounds like this you're missing these things. This is important to you. What could you do? What can you do about it? And Simone comes up with something that is so out of left field, right? That nobody else would have come up with that solution, but it's one that's going to work for her. And that's the person it needs to work for. So it's such a good example. And this lady did such a great job with it. Um, okay. So I'll tell you a tiny bit more about the research studies and then just leave you with some resources that you can check out if you want to learn and train more. And then we can go into the questions. I have questions that you submitted, and Rich has gone through and collected those. And if there's other ones that are coming up as you listen, please put them in the chat, and we'll read through those as well at the end, and get to what we get to. So my questions were really, would caregivers want to learn these skills? And what kind of curriculum are people interested in? And also, how does learning these skills then affect families? Like, will it affect stress? Will it affect their self-confidence? Will it affect their level of family conflict? And also, does it affect those things for a day, or do we see any kind of evidence of a lasting result, something that might make a difference over the long term? So, like I said, I had 131 people participate. And we did the training in a couple different formats. Sometimes people met one-on-one with me or one of the therapists on my team over like 4 or 5 sessions to train in the skills. And sometimes we met in groups, again, to train in the skills, or like I would meet with a couple. Um, and it was mostly ladies, mostly moms, average age of 53. And they were talking to me not for fun. They were there because they were dealing with some pretty serious family situations. 60% reported that their child or loved one had at least one previous psychiatric hospitalization, um, more than half experienced psychosis, and about half were actively using drugs or alcohol. So we asked them, like at the end of the training, but then again 12 weeks later, like what changes have you noticed since you learned the skills? And people really had lovely things to say. One person said, my children are willing to listen to me and not dismiss what I'm saying. Another person said, conversations are not as intense or as volatile. I've incorporated skills that help me cope and that's helped my children. And isn't that really the key when we're parenting is like, if we feel like we see the path, it helps us stay calm. Um, I feel that I find that I'm holding back on criticizing my child for decisions, and instead I try and find out from her what her motivations are by asking curious questions rather than judging. Another person wrote, I think I have more productive discussions with my child, and that makes me feel better about myself and as a parent. And another person said, my daughter feels more validated and heard, which has decreased her acting out in outbursts. So that was some of the kind of qualitative feedback we got. We also had people fill out questionnaires reflecting these 4 sort of psychological domains before they did the training, after they did the training, 8 weeks after that, and then 12 weeks later. So what we saw was nice change in the directions that we expected. And these are pretty significant effect sizes. If any of you work in research, you know that like not all change is actually like meaningful. But we had effect sizes that were around 1 on most of these domains, which is large. So we measured stress, self-confidence, and their reports of family conflict and expressed emotion. In the family conflict, especially, we saw a really big drop. And what was cool is that for both the groups and the one-on-one meetings, we saw a drop from pre to post, and then we saw continued improvement in the follow-up period where we weren't talking to people or helping them anymore. We were just sending them these surveys a few months down the road. For the other things, we saw improvement and then stable, but they remained improved. So those are some initial research studies that had some really promising results. I'm working with colleagues to do some replication studies. I have a colleague in actually at the University of Oslo in Norway who's doing, we're doing this there with, parents similar to yourself, like who have children or other relatives with mental health problems, and they're getting the Milo training translated into Norwegian. And he's using more or less the same protocol, so we'll see what kind of results he gets. And then I have a couple grants that I prepared with colleagues under review to see if we can replicate this closer to home. But if you want to learn more, let me leave you with a few ways to do that. So the first resource that I'll recommend is my book. It's like, I don't have a copy sitting in front of me. Otherwise, I would show you. It's like pretty short. Like you could read it in a day, I think. And it really goes through all of these skills in some detail. And I have sort of like anonymized but real families that I know very well who made their way into this book. And I write it in a series of scripts. So it's a lot of the chapters are like reading a play where it's like, dad says this, and then the person says this, and they go back and forth, and then say, okay, well, let's tweak what he says, and let's have it be a reflection instead, and see how that changes the conversation. So I think it's hopefully a fun read for people. And it really, there's like a 5-step kind of checklist to get through a hard talk in there. So you can get that on Amazon or wherever you like to buy books. Another resource is my e-course. So it covers a lot of the same material. And this is on this website that's actually owned by the Massachusetts Department of Mental Health. And it's free because I create it with the Department of Mental Health. So they paid me to create this content, and as long as it would be free for people to access. So this is really popular. Like I'm amazed how many people have done this. I haven't gotten a head count in a while, but it's like well into like figures, people who've done this course, which is very cool. You can find it by just Googling like School of Hard Talks online. And what you'll find here is like it's these interactive little 10-minute chunks, and there's 7 of them. And it's not me looking at a camera talking at you like this. Like you won't see me, you won't hear my voice. These are real actors, an actual designer. But I wrote it, so it's the same stuff. And I have to say, the day that I got to cast the parts was like the best day of work ever. It's very cool hearing different actors read the parts. And then also just feel free to get in touch with me. This is my website. There's like a contact link there. It goes right to my email. I read my email. I'll get back to you if you want to, if you have a question, if you want to see if I have any room in my schedule to meet with you. If you know someone else who wants to learn motivational interviewing, I'm happy to hear from you. I should also mention one more. One of my colleagues from when I was at Boston Medical, Dr. Badia Ipekchi, is also offering Milo. I trained her when I worked there. She's fantastic. And if you work with her, you can actually register as a patient at BMC, and she will see you over telehealth, advise you on these skills, and it can go through your insurance, which is awesome. So I think that's all I've prepared for you tonight. So we can kind of move into a more informal Q&A.
Great. Thank you, Emily, so much. That was super helpful. I just took a few notes for myself and just good reminders that you can't influence anyone. I love when you said that. And to slow down and to use silence as a tool and to be curious about the other person's perspective and working on open-ended questions. That's just part of so much good advice. We've gotten a lot of questions, so let's just try to roll through as many as we can. Not in any order, they're just all important, but let's just try them out. Here we go. Can you talk someone out of being paranoid?
Ooh, okay. Can you talk someone out of being paranoid? So I would say that, paranoia is a symptom of mental illness, right? And you can't just like nice that away. But at symptoms of depression, anxiety, psychosis, they fluctuate, right? They're not always at a 10 out of 10. And a lot of what makes them fluctuate is stress. And so if you help a person kind of relax and not feel that they're being confronted, they may be less paranoid than when they feel stressed out and defensive and they're defending their worldview and they feel like everyone's against them. So I don't think that any of these strategies can like cure paranoia or cure mental illness. I do not think that. But I think that you are going to get somebody's best side and their most reasonable self when you try and slow down, stop telling them, no, you're wrong, you're wrong, you're wrong, and just say, okay, tell me more about that. Offer some reflection. So it sounds like you feel people are out to get you. It sounds like you feel there's no way these are coincidences. That must be really hard. Tell me more. Well, can I offer my perspective? What do you think about that? How do you make sense of it? You might get a less paranoid side of them, at least in that moment. It might not endure, and that can be frustrating.
So what I get from that is there's an emotional range that we all live in, you and the other person, and you're trying to get to the top of your range, and you're trying to get them to the top of their range with the best chance of connecting and getting someplace useful. I think that's what I heard. Here's the next one. A lot of us have been here. How do I ask my 24-year-old son to move out?
How do I ask my 24-year-old son to move out? That is a very tough situation. Um, and I would be really curious to delve more with this person into what's going on and what they've already tried. Um, I think if you've never had the conversation, which I talk to a lot of parents who they're really nervous to have that conversation or other difficult conversations because they're worried it will go badly and set them back in the relationship. I think you have to kind of be somewhat direct and have it, and say, hey, this isn't a today thing, but I'm curious. I've noticed that whatever is your reason for wanting to move out, like, seems like we're not getting along so well, or, me, I would like more of my own space back, um, or whatever is your reason, and say, what do you think about that? What do you think about eventually moving out? And just start having the conversation again, not in a way that's like this is happening today, but being clear about what your goal is, and then asking them what they think, and trying to use these skills to have a conversation about, like, okay, let's find the path that leads in that direction.
So let me ask you a related question. This next one is, how do I deal when my adult child is explosive and threatens me during conversations? So that's kind
Yeah.
of up a grade level.
Yeah, yeah, yeah. And sometimes that's the reason people need their relatives to move out of the house, right? Often that is the reason. Um, so my advice is always like, it's never worth getting assaulted. I would not stay in a conversation where I didn't feel safe. I wouldn't. And I have worked with so many families that have been in that situation. Um, and and then I also work with so many families who don't realize they're in that situation and things are getting quite explosive, but they're continuing to persist in these kind of explosive conversations. And I'm like, I would leave the room. Like, I don't think you're losing anything by walking away from that conversation. And they feel like they can't let this person kind of win. But having worked with many families where, there's been an argument that became assaultive, like, that's not a world that you want to live in if you can avoid it. So I think walk away.
So
Um,
safety first.
Safety first. I wouldn't, yeah, I think that's important. And I also just want to normalize that, like, yes, that happens. And I think a lot of these families, probably on this call or in NAMI meetings, have been there, and it's a really tough thing.
So here's one. How do I get someone who equates his mental illness with being called stupid or says, this is just the way I am, to accept treatment?
Mm. Um, that's hard, and it reminds me of a lot of people I've met and I've seen in practice. Um, where So one way to think about this, and I mean, maybe this person has already tried it, but to think about naming problems rather than diagnoses. So what I mean by that is to say, like, okay, something like depression or schizophrenia, these are diagnoses. But things like feeling sluggish or feeling unmotivated, feeling bad about yourself, not wanting to socialize with people whose company you used to enjoy. These are problems, right? And I think that we all have problems, and sometimes we're more receptive to talking through our problems, especially with our friends in family, than using this more clinical language like, oh, you need to get some treatment for your schizophrenia. Well, that might not go over well, but something like, well, I've noticed that you seem really stressed and you're not sleeping well. Um, that might be a problem that the person is more open to talking about.
Well, that brings up this next question that's related. How can I use motivational interviewing for people who are in psychosis? And I guess I would add, is it even possible?
Mm. So it might not be, I'm not a wizard. This is not a magic wand. Um, and I will say that I've been very humbled by certain patients over the years who they like react really badly to this stuff, or they don't understand the reflection. They're like, why are you repeating back what I said? And the whole thing just kind of makes them feel like paranoid or misunderstood. Um, and so again, it's not magic. It works a lot. It works pretty well. I think it's incredibly useful, but it doesn't work all the time with everybody. I think if somebody is really deeply in psychosis, you might not be able to problem solve higher order problems with them, like getting a job or going back to school or finding their own apartment. But even when someone's in psychosis, some of these tools can be useful for kind of just breaking through a little bit of the noise and having a nice conversation, even if it's about something like, okay, well, we're sitting in the car for an hour. What should we listen to? Right? Rather than sitting in silence or getting into an argument, to have a more collaborative discussion about something that's pretty low stakes.
So
Um,
sometimes it's just more about the connection than the
yeah,
content, more
yeah,
about the
exactly.
affect than the content.
Yeah, well put. Yeah.
Yeah. Let's try this one's from the live chat here. Can you offer suggestions for interacting with a loved one who expresses agitation and feeling defeated? For example, what ideas they might have? They respond quite agitated, often saying, I don't know, nothing's going to get better. Very negative.
Hmm. So my favorite way to respond to that is to do a feelings reflection and to say, you are feeling totally hopeless, and just let that sit, because I think some people have never been that they've never recognized that feeling or been able to talk about it with anybody. And it feels really good for somebody to witness that and name it like, oh, yeah, I am feeling hopeless. I feel like nothing's ever going to change. Um, and it might not be the right time to problem solve if somebody really is kind of deep in their hopelessness, but it might also open the door for the next conversation to say, oh, yeah, this person gets me. I felt understood last time I talked to her. They might come into the next conversation a little less rigid or a little less kind of with their heels dug in, trying to prove, like, it's like people will argue to prove their point until they have proved it. And when I'm like, wow, you've tried everything, you sound completely hopeless. This is a really tough one. Um, it
Look,
may sound bad, but like weirdly, it feels good.
so this is a related question here in the live chat. So this is about the technique.
Uh-huh.
And this person says, so what do you say when they are asking you things like, why are you repeating what I said? I feel if it were me, I would find it very odd. And this person goes on, I also wonder about making those statements such as, you were feeling hopeless. Wouldn't they be annoyed that you were telling them how they are feeling instead of asking them?
So I get your skepticism. You sound skeptical. Let me do that reflection. Um,
Not me,
you
this
sound pretty
person asking.
skeptical. And again, this is not, I'm always kind of modeling it while I'm teaching it because I really believe in this stuff. It's your choice, right? It's totally up to you. I'm not going to tell you how to talk to your loved one. If this doesn't feel natural, it might not be a good fit. But what I have found is that people love it. Oh my God, people love it. And I find it both in my practice that people really like it, in my personal life, and also of the many, many family members I've taught, they come back and they're like, whoa, that stuff really works. So I guess my advice, if you want to take it, is I don't know, try it and like let me know, right? Feel free to get in touch with me, write me an email about, whether that person felt that it was like silly or awkward, or whether they were like, yeah, I do feel hopeless. And let me tell you what else. And because in my experience, when you do a good reflection, the person is like, ah, okay, now
Don't
I
you think
want.
that the affect in part is in part you care about me?
Yeah, and you're listening and you take me seriously and you're
Yeah.
not trying to change the subject or cheer me up or tell me what to do.
Here's a live chat question. How do you create and get family members to respect boundaries without causing conflict?
I have a lot of questions for this person because that is like very abstract. And as I've told you all, I don't do great with abstract. I need details in order to be useful.
Give it a shot.
So, yeah, I guess I don't know. I'm not sure. I'm sorry to this person. I don't have great advice on that one.
Fair enough. How about when someone refuses to respond to questions?
hmm and it's so frustrating because there can be so many reasons for that. We don't ever know when we're talking. I mean, especially as a professional where I don't know the person that well, right? Like I'm coming in as a therapist. I don't know whether this is like a cognitive processing speed issue. I don't know whether they're having like profound negative symptoms and they're having trouble coming up with words or putting thoughts into words. Um, I don't know if they just don't like me and don't feel comfortable with me, or if it's just not the right day and their mood is not in the right place to have that conversation. So I try and just be respectful and be like, maybe it's not the right time. Let's,
Fair
would it be
enough.
okay to come back to it?
Here's kind
If
of a
it's not
related
going to work, if you
question.
fix it. Yeah.
I'm sorry. So, how to respond when a loved one hears the voice of God telling them things that are terrifying and shaming?
Oh, that's so scary and sad. Um, I mean, I would, if you can tolerate it, again, this is not, you're not a psychologist, right? Like it's hard to hear this stuff from your family member. But if you can tolerate it, you could invite them to tell you more because sometimes even saying this stuff out loud takes a little bit of the heaviness and the realness away. Um, it's like holding something up in the light. Sometimes it looks a little different. Um, so you could see if they want to tell you more about it, and just listen, or just say something like that must be really painful to hear. Um, and ask if they want your advice, if you have any advice, whether that advice is like spiritual advice or like, let's tell your doctor about this and maybe they want to change like your medication dose, or whether it's, just more like coping advice, like next time that happens, like call me, like I'm here for you, we can go for a walk.
Great. Here is a very practical, straightforward question. I think you know exactly what they mean. How do I get my loved one to not talk with their mouth full and not shout when talking?
Okay, so this is where that I've noticed construction is so helpful. So uh I've noticed that it's hard for you to wait until you swallowed to tell me what you want to tell me, but I can understand you so much better if you can just hang on for a moment. And you may need to remind them. And I also, I mean, as the parent of younger children, I will say that I'm always thinking about what I call my ratio. Right? So, and what I mean by that is like for how many sort of corrections I'm giving to like other kinds of interactions. So, if this is a chronic problem, you might want to wait for a day where your ratio is like looking good, like you were talking about a band you like, and you're talking about the Celtics, and you're talking about the weather, and you're talking about an upcoming holiday and oh, by the way, do you mind just not doing that? I don't like it when you do that. And then again, back into something more positive so that it's not like this kind of scoldy.
Right. So, kind of along the same line of habits that our loved ones sometimes do that are really self-destructive. How about this one? Overspending money.
Uh, so there's a lot going on there because I know like all families are very unique and different in terms of how they're setting up their accounts and who has access to what. Um, so maybe there's a combination of communication, but also a practical fix that needs to happen. Like, hey, let's get you a checking account that has $500 at a time in it, and you can have a debit card for that account. Um, that's practical, right? Like it's a specific practical solution to someone who's racking up credit card bills. But you still have to communicate about the solution with that person. So you might say, hey, I've noticed that we're getting these large bills on the credit card. Can you tell me more about what's happening there? And again, just kind of follow these same steps, like ask for more information, reflect back what you're hearing, ask clarifying questions, ask for their ideas. Like, is there, what do you think is a good way to approach this? Or what do you want to do? Is there anything you'd like to try doing differently? And then say, well, I have a thought, which is that let's not use a credit card or let's use a credit card with a $300 limit or something like that, right? Something that will solve the problem. Um, and but again, I think it's going to go better if you communicate about it and you try and do those steps and have a somewhat collaborative conversation, even if you might need to implement a solution that is a little bit more, protecting yourself.
These tools really take some practice, don't they? I mean, you don't just figure out how to do this on day one.
No, but the template is pretty standard, right? And that's what is kind of cool about it is that it's very hard to do, but the template is simple. So you can always say, hey, I noticed this problem. Can you tell me what's going on for you? Ask lots of questions, do lots of reflections, and then say, well, what do you think we should do about it? Or what do you want to do about it? And then say, well, here's what I would like to do about it, or here's what I'd like you to do about it. And depending on, I think the other kind of tricky philosophical piece that I'm always talking about with families is like, let's get really brutally honest with ourselves. Is this something you can control? Right? Is it? I want to know, is it for real? Because if your loved one has access to your credit card, maybe that is something you can control and you can change something that's going to improve that situation. But if it's something more like, your loved one talks with their mouth full, you can't control that. That's not your thing to control. So, any advice you give is simply advice.
How about this one? This is from a parent who says, two young adult sons with severe mental illness who treat me like the enemy.
I'm sorry. That sounds really painful. Um, oof. Yeah, I hope that person has people who love them and support them in their life so they can get a break from that sometimes. Um, it almost doesn't even sound like there's a particular dilemma that they're asking for advice about. It's just a very difficult situation.
How much do your techniques get into the whole area of self-care for yourself?
So I think that that's a really interesting question. I like that question. I think that you find a path back to sanity the minute you start asking yourself that question of what can I actually control here? And it doesn't mean that the things you cannot control are not difficult, right? But this is the AA mantra too, right? And this is some wisdom. Like let me understand, let me learn how to change the things I can control and accept the things I cannot, and have the wisdom to know the difference. Um, and part of these strategies are really rooted in that philosophy specifically of saying, if this is something that is not mine to control, how do I approach it? And the best you can do is try and have a good conversation about it and offer your advice in a way that is most likely to be well received. But at the end of the day, know that it's not your thing to control, and it's just not, you can't carry that around. So I think that is a form of self-care, is to kind of think about like, okay, I can't control that. I'm not going to carry it around with me. Um, and also just to sort of, yeah, accept that not everything is on your shoulders, even though I know for a lot of the families here tonight, you probably wish it were on your shoulders, and that you could control it.
Here's a kind of related question. My loved one says to me, I can cure myself. You don't believe me, therefore you don't respect me. How do we deal with that?
Hmm. I can cure myself and you don't believe me. I mean, I guess the way that I would respond to that is, because I'm such like a intentionally stupid and concrete thinker about these things, I'd be like, really? Like, great, what are you doing? Like, what's working? How's that going for you? Right? Like, what are you doing that is going well to cure yourself? And try and get out of this sort of like high level, like you believe me, you respect me, you don't, and more into, again, like the details of the things that make up everyday life. Oh, great. Like, what have you tried? How's it working? And to have a non-judgmental and supportive conversation about that. And maybe there's certain things they're doing that are working well and certain things they're doing that are not working so well. But the more you can communicate on that level and not on this like big, heavy level, I think the better it will go.
Here's a related question. Dealing with secrecy and lying, how to get at the truth.
So I I mean, I don't know. I'm again very curious the details of what this person's thinking about or talking about, but I do have a strong philosophy around sharing what you know and not putting a person in a position to like dig their hole deeper, because I think that is so, oh, it just leads to so much like weird anger and conflict. So what I mean by that is to say, hey, I found this credit card bill, or I found this bag of weed, or I found these edibles, or I found these empty bottles, and just to be really direct, like here's the facts that I'm aware of. I'm putting them out there with you to have a conversation about it. But to say that instead of saying like, have you been smoking again? Right? Like I don't, like if you know, you know.
So let's follow up on that one. So my daughter says, I don't think there's anything wrong with smoking marijuana. A lot of people do it. It's legal, and I don't understand why you're bothering me about it.
Mhm. Well, that's all true.
So how do you deal with that, daughter? What are some
Um,
ideas? Couple ideas.
so I guess it would like it depends on the context, right? Like you're bringing it up now, so I'm assuming this is somebody whose use you're worried about, or you see it's affecting them negatively. Or maybe you're only worried about it because she's 13 and really shouldn't be using marijuana at 13. Um, so maybe if it's somebody whose use you're worried about because they've used problematically in the past, and then they managed to quit, and then maybe you're seeing evidence that they're using again. And when you bring it up, like, hey, I noticed these vape cartridges in the trash, that's the response you get. So I'm just created like a whole scenario. I might say something like, yeah, okay, so you're feeling like no big deal, everything's fine. and just start with that reflection and see if I can get her talking more about it. Um, and then maybe if that goes okay, to say something like, so, in the past you felt like it was affecting you badly. Like, what were the things that you didn't like? Um, and try and explore that, and see if she can remember. Um, or I always like to ask somebody, like, hypothetically, like, what would be the sign that you were using too much? Again, not that that's happening now, but just what are your thoughts?
Sure.
Um, and see, and then reflect that. And then again, to offer maybe if at that point in the conversation, my own concern, like, can I share my take? Um, like, here's what I think. Like, I think it was this got really hard for you in the past, and it really affected your mental health, your physical health, and it was hard for you to quit. And so I can't help but really worry when I see that you're using it again. I don't, I personally hate it, but I recognize that it's your choice. But yeah, like I just want you to know that I know and I worry about you.
Fair
Um,
enough.
and so that's kind
So,
of like having that conversation.
yeah. So we just have a few minutes left, and I think as I said at the beginning, there's no way we're going to get to all these great and hard questions. And you did ask for all the hard questions, and thank you for doing that. Here's one that this is a live question. Very interesting. How do you implement all of this training without sounding patronizing, especially when in some cultures mental health is considered not a problem or doesn't even really exist?
So what's nice about these skills is that like you can always ask a question instead of going into like a lecture, right? That's not mental health. That's just trying a different way of communicating. So I would just start there or start with saying, okay, so am I hearing you right? It kind of sounds like you think XYZ. Just try one question or one reflection where you normally would have gone into like giving advice or doing a lecture, and just see how that goes. And if you can pull it off without feeling patronizing. It is, I'm not gonna lie, it's disingenuous, right? Because what you are doing is you are putting that urge to solve the problem for somebody and just give them the answer away. And instead, you're doing something that's going to feel weird and fake and maybe patronizing. Um, but it isn't necessarily patronizing to just ask more questions before giving someone advice. And in fact, you might think it's the opposite, like it's more respectful, and less patronizing to give less advice. And to hold back on solving problems for other people. And instead just ask them like, oh, well, how did this come up? And tell me more. And what do you want to do about it? And is there anything, do you want my advice or no? It's definitely going to feel fake, but I don't think it's necessarily going to feel patronizing. And the other thing is that we can use these strategies again to just talk about problems that people are having and not even get into these areas of like mental health labels and diagnosing and calling something depression or calling it an addiction. You're just talking about the problems that people are having in their everyday lives.
We should probably stop there. There's so many more great questions, and thank you, all of you who sent these in. But I want to, Emily, just give you a chance to kind of summarize how people could understand what you've talked about tonight and maybe what some simple next steps would be.
Yes, thank you. Such good questions. I would say, if you want to try any of this, my advice is to recognize that impulse to fix other people's problems for them, to give them advice, and not to say I don't have any good advice to give people, but to think, is this the right moment? Is this the right moment, or do I really just need to help them feel more understood before they're going to be receptive to problem solving or following my advice? And also to just recognize that there's only so much you can control in other people's lives. So helping them problem solve is sometimes much more impactful than just kind of giving them what you think they should do. And finally, if you want to talk more about this with somebody, again, my colleague, Dr. Pekchi at BMC, is offering some Milo training. I'm offering some Milo training. You can check out the book or the free e-course. And if there's therapists who want to train in this, I'm happy to work with them as well. And hopefully we can make this more widely available and get the word out there.
Great. Well, some of us are family support group facilitators, and these types of hard questions come to us every time we have a support group. So these techniques, I think, are very useful and helpful. And I can't thank you enough for giving us your time and your wisdom. And thanks to the participants, and wish you all a good night.
Thank you. Good night.
Take care.